See, Esse Health is very entrepreneurial in spirit. That's what's kept the group independent for the history of this company.
Esse is owned by the physicians, which gives us control over how we take care of our patients, the products that we are able to use to take care of our patients. The ability to connect in a mechanism that allows the appropriate communication but doesn't negatively impact anyone's schedule was a challenge.
Most of the way patients communicate when I first started working there was via phone calls. Well, the hardest part is of patients actually communicating with the doctors is getting a hold of the doctor.
So the problem that I initially saw Well helping us solve is communication and access. Just the anecdotal evidence that we get from our patients is that they love having the ability to text message their physician.
Well has made my job tons easier. I think it's going to improve our overall timeliness of getting things filed for the administrative aspect of it.
Implementation was the easiest implementation of any electronic tool we've had, because pretty much we opened an app and we started working. There was no 8-hour training course, no giant book. It was pretty seamless.
As opposed to another technology where you rip and replace, that can be very disruptive to an office. But with Well, the way we phase in and stage notifying our patients and marketing the product, it gives the staff the ability to obtain a comfort level. So it's really a ramp up as you're comfortable with rather than all at once.
My initial impression of Well was, wow, this is easy. This is just like texting on my phone. It's not here to replace us. It's here to help us.
All of my families text heavily, so this is just using their standard means of communication to now be able to safely communicate with us. It's not new technology for the families, and it's honestly not new technology for most of my office staff, except they're no longer doing it on their personal device. They're doing it on the computer screen in a HIPAA-secure environment.
I absolutely think that patients associate quality of communication with quality of care. Patients have choices now. They can go to urgent care, they can go to their physician, they can go to the ER, they have a lot of choices.
I think the quality of care for a patient is not just coming in and getting, a good doctor. They're looking for a medical home. As that office doesn't have good doctors, they have good patient service representatives. They have good tools that they use in their office. And I think we have that at Esse. I think Well is a great part of that.